Hello, greetings to one and all. I am Dr. Vinay Kumar, Hepatologist at Narayana Health City, Bangalore. Today on July 28th, we are celebrating World Hepatitis Day. This is just to bring awareness to common people about a problem called hepatitis, which causes liver disease and liver failure who have the various kind of infection. In this small talk, I would like to request Dr. Ravi Kiran, our consultant hepatologist at Narayana Health, to give some information about commonly asked questions about hepatitis. Hello, Dr. Ravi Kiran.
Hi.
Today we will be asking you about common questions which we usually get in our OPD consultation. So in order to bring the awareness, I want you to answer about these questions which are very important.
Sure.
Now, I want to ask you, what is hepatitis in a general purpose?
So hepatitis is related with the liver. Any injury which is caused to the liver is called as hepatitis, and hepatitis can be caused to the various causes like consuming alcohol can cause alcoholic hepatitis, accumulation of fat in the liver can cause fatty liver, that is called non-alcoholic steatohepatitis, and inflammation or infection of the liver due to various viruses like viruses A, B, etc. can cause viral hepatitis. So hepatitis in general means inflammation of the liver.
So I just want to emphasis on some viral causes, because this is as it affects many people and it is easily preventable in a few steps. So I would like to ask you, what are the common causes of hepatitis caused by various hepatitis viruses?
Yeah, so there are multiple viral hepatitis viruses which can primarily affect the liver. Alphabetically, it is hepatitis A, hepatitis B, hepatitis E, hepatitis D, and hepatitis E. Of all these viruses, most common and non-serious sort of infection of the liver is due to hepatitis A and hepatitis E, which is more in young age and in the children. And hepatitis B and hepatitis C are notorious to cause long-term damage to the liver.
Okay, so hepatitis B and C is more of a chronic problem which can cause liver damage in the future.
Yes.
So I just want to ask, is there any difference between the acute hepatitis in case of hepatitis B and a chronic infection because of hepatitis B? Is there any difference because of that?
So acute hepatitis more often than not is self-limiting. If you support the liver, if the medicines and the care is taken at that point of time, generally the liver has the capacity to become normal. And acute hepatitis is manifested by jaundice. People come to us with jaundice. If we support the liver well, as I said, the liver functions will normalize. What happens in chronicity and acute hepatitis is most commonly caused by hepatitis A and hepatitis, as I told you, but hepatitis B and hepatitis C can also cause acute hepatitis, but it is very rare. In chronic hepatitis, by definition, it is if the person is having hepatitis B for more than 6 months, it is called chronicity. So the patient is having hepatitis infection for a long time. This is very notorious because people may have this infection with them and they may not show up with any symptoms.
So this is the most important point, where one person might have infection and may not be recognized or diagnosed with the problem, and usually the patient will have symptoms at a later stage of the disease. So the theme for this year, that is on this World Hepatitis Day, is World Can't Wait, or we can't wait. So the issue is we have to get early diagnosis so that the treatment can be appropriately started and the benefit of the treatment can be passed on to the patient. Now I just want to ask Dr. Ravi Kiran, is there how common is hepatitis B and C infection in India?
So before coming to India, we can speak in a larger perspective about the world. See, we know that we know about tuberculosis, right? When you see about tuberculosis, we feel that it is very serious, but mind you, hepatitis B and hepatitis C can the viral hepatitis can cause mortality to the level of tuberculosis. So if tuberculosis is number one, equally number one is hepatitis, mortality due to hepatitis. So only following this hepatitis is infections due to HIV. Coming to India in particular, India is an endemic country for hepatitis. So we are in the intermediate endemicity stage, where they say if the endemicity is around 4%, we call it as intermediate stage. So yes, so in India we have people who are infected the range of around 4%. So if there are 100 people, 4 people may have hepatitis virus. That is for hepatitis virus B. So for hepatitis virus C, it is common in areas where people use more. There are certain areas in the country where they use more IV drugs and all this stuff. So there the prevalence of hepatitis C is more. So the highest incidence of hepatitis C in India is around 11% in various part of the country.
Okay, especially in the northern part where it has become a problem of sorts. Now, so he talked about how it is spreading and where it is spreading, so we'll go in detail about that. So I just wanted to ask Dr. Ravi Kiran, how does this hepatitis B and C usually spread? Because you said that it's commonly present in patients who are asymptomatic. So how does it spread?
So hepatitis B and hepatitis C are blood-borne virus infections. So anything which can spread by blood, any situation where there is direct blood contact, it can spread hepatitis B and C. Basically, to remember the safe blood transfusion, so it can spread through the blood transfusions. Initially in 1980s, there was no testing for hepatitis B and hepatitis C when there was transfusion of the blood. So of late, all the blood banks, they test for hepatitis B and hepatitis C also. So the transfusion of hepatitis B and hepatitis C through blood transfusion has become less. So that is one thing. The second thing is the sexual transmission, and the third thing is the vertical transmission, especially for hepatitis B. Now the most common cause for spread of hepatitis B is vertical transmission, coming from mother to child, and IV drug abuse. So people who use who abuse the IV drugs, they have more chances of getting hepatitis C, and in certain communities they use the tattooing, so they tattoo the skin. So in these communities the spread of hepatitis B and hepatitis C is seen.
This is very important because most of us are getting exposed in these ways, especially the sharps which has been infected. So one must be careful about the needle sharing and other things, and should take all the precautions necessary to avoid the contact of a blood with probable source of infection. So you told about the different ways of transmission of the virus. You also mentioned about the transmission through sexual contact. So who are those patients who are at higher risk of this kind of transmission, and what precautions they should take so that this can be prevented?
So definitely yes. If there is if the hepatitis virus can spread through the sexual contact, for hepatitis B we have a vaccine, so definitely patients have people have to get vaccinated for hepatitis B to prevent the spread. The second thing is the barrier protection, and also it is seen in the transmission is more in male to male sexual contact. So if possible, that has to be avoided.
So unprotected sex,
yes,
with probable infection person can always transmit, although the chances depends upon the various situation. Now I just wanted to ask, like, if there is a blood spill, what are the chances of that transmitting, and how one can just take a small precautions to prevent it?
Yes, so blood spill is a good question, especially with the
healthcare professionals,
with the people who are involved in the healthcare. Just by the blood spill, unless it is contaminated and that is in contact with the raw surface of your body, they're like a cut surface, there may not be the chances of transmission. But yes, if there is a direct prick on the body from the person who is hepatitis B or hepatitis C infected, then definitely the chances of the transmissions are high. Transmission of hepatitis virus is high. At that point of time, please contact your doctor in the hospital, who will advise you certain tests and will definitely tell you what if the medicines have to be taken for it.
One more thing is, I just want to ask, like, what are the, if most commonly asked question is, if a person is infected with hepatitis B or hepatitis C virus, can they donate blood or donate organs in the future? What are the chances of transmission through that?
So, good question. Definitely, there is no scope of donating blood if the person is infected with hepatitis B and hepatitis C. So, make sure that you don't donate blood if you are known to be infected with hepatitis B or hepatitis C. With organ donation, various countries have various laws regarding organ donation. In the West, the organs are accepted by a dead donor, even if the person is a hepatitis B or hepatitis C. So the donation of an organ depends on the circumstances and the laws prevalent in the countries or in the area where they reside.
Okay. So one more question is, if you are getting exposed, can the vaccine prevent hepatitis B or hepatitis C? Is there any vaccine for both?
We have a very good vaccine which is which has protected the humanity from hepatitis B since last couple of decades. Unfortunately, the vaccine for hepatitis C is still elusive. The research is still on, but we are not sure. We are not seeing it to be coming to the market soon. So hepatitis B has a very good vaccine. It has to be taken proactively, but by everyone, and it has been already included in universal immunization program. So most of the kids these days are already immunized with hepatitis B. The people who don't have vaccination with hepatitis B, definitely yes, they should be vaccinated with hepatitis B to prevent the transmission of the virus.
So one more thing is, if a person is vaccinated in the past, but don't know about the protection, so what should he do? Should he take a dose of vaccine, or should he get a test done for that?
Yeah. So if someone is unaware of whether he or she is vaccinated or not, we have a very simple blood test to know the antibody titers for hepatitis B in the blood. There is some cutoff value, what is called as 10. If the value is less than 10, we say it is non-responder. If it is above 10, the person is definitely protective. So if you are too much concerned to know whether you are protected from the infection with hepatitis B, definitely you can get that HBS titer done.
So hepatitis B vaccine, if you are not got the vaccination, please do get it. Or if not, if you are not aware, get a test done, and you can get always a booster dose to improve your immunity. Now the next question is, as I say again, concerning with hepatitis B, is there any mandatory test to be done before international travel or any traveling if you are not aware of the hepatitis B, sir?
Hepatitis B, I mean, it depends on the visa rules of various countries. If you are going for travel, I don't think any country asks for that. But the caveat is that different countries have different rules. Few countries mandate hepatitis B infection status when you are applying for work permit and stuff. So it depends on the various countries which you plan to travel.
Okay. So one more group of patients are pregnant women. So how safe is the hepatitis B vaccine, and can they take during the pregnancy if they are not taken the vaccination in the prior years?
So hepatitis B, HIV and hepatitis C, these are most common. It's like most often done than not in all the pregnant female, to just screen for the well-being of the pregnant women as well as also the infant or the fetus. So if the person is not vaccinated, the patient can take vaccination if they are hepatitis B negative. If they are hepatitis B positive, obviously there will be no use of getting vaccinated again. The doctors will tell you regarding the amount of virus which is there in the blood, and they may suggest the treatment in the last trimester, that is the last 3 months, if the virus value is a bit higher, to prevent the transmission of the virus from mother to child.
So if there is a pregnant lady with hepatitis B infection and we have a high titers, the treatment per se can help the both mother and the kid to have a safe delivery, and the transmission is less. So it is a very good way to treat the patient as well as prevent the transmission as such. So one more question is regarding that, sir. Usually this hepatitis B and C, how they usually present to you? Are most of them symptomatic or asymptomatic? And what are the symptoms they get if they have a chronic problem?
So it's like the patients come to us with varied presentations. Few people may not have any symptoms. A few patients come to us with a blood report which is done as a part of annual health checkup, where their liver function test is bit off. So when we do hepatitis B and hepatitis C, either of one can come positive. That is one sort of presentation. The second sort of people come to us with an ultrasound report where they say that liver is a bit abnormal, there is a fatty liver, there is some liver enlargement. So this is the second set of presentation. The third set of presentation, which is rare presentation, is the person or the patient was apparently fine for and since few days or a week or so, the patient develops jaundice. When we evaluate for what are the causes of jaundice, we can get either of hepatitis B or hepatitis A positive. The most important and the concept of this World Hepatitis Day is on the prevention of this long-term effects. As I told you, these are the patients which have been harboring hepatitis B and C in the long time, and they come to us with swelling of the abdomen, means that there is water in the belly. They can come up with vomiting of blood, they can come with swelling of the feet, and they can come with advanced liver disease where the liver is very shrunken, the spleen is enlarged, and the platelet counts coming down. So this is the time when we have to be a bit conscious and be treated correctly for the disease.
So you are saying there are multiple stages of liver disease per se, which they can present with various symptoms. So you said like there is a asymptomatic stage and then the progression of the disease and causing problems. Now, what are the complications if they have a chronic liver disease? What they can develop in the future? So
Vinay, the liver, as I tell, is a very smooth organ. Whenever there is an injury to the liver because of hepatitis B, hepatitis C, alcohol, or anything for that matter, it progressively get hardened. So once the liver is hardened, the functionality of the liver is reduced, and because the functionality of the liver is like a powerhouse of the body, okay, so it is a very important organ. Without organ, it's very difficult for the body to function normally. So when the function of the liver is reduced, patients develop jaundice. Because the blood flow is not normal into the liver, there is a we can say in the layman term, there is a black flow of that, and there is seepage of that blood as fluid in the abdomen, and also there will be back channels of the blood which the patients can vomit out blood. So this it gradually progresses. It's not that hepatitis B is infected like say yesterday and you have the symptoms today. This takes couple of decades for the progression, especially with hepatitis C. It takes a couple of decades for progression from the infection. It becomes a chronic hepatitis phase. From that chronic hepatitis phase, it can lead to cirrhosis in couple of decades. So in hepatitis B, it can be a bit early, but yes, even that it takes many years to progress from a normal liver infection to a diseased liver. And other thing is that these patients can also develop cancers of liver cancer. Hepatitis B and hepatitis C, they account for most number of cancers. In fact, 50% of the liver cancers are due to hepatitis B, and 20-30% of the cancers are due to hepatitis C. Yes.
So what are the other conditions which are usually associated with these infections? And if you don't control that, the progression might be faster or slower, whatever other conditions which can be associated.
So the conditions in the sense that if the patient is having fatty liver already, so it will be 2 for tango, right? So fatty liver is already affecting the liver. Over that, if there is infection with hepatitis B and hepatitis C, the progression of the liver disease will be faster. That is one. The next thing is alcohol. Obviously, alcohol is also causing direct effect of the liver. With that, hepatitis virus is also causing infection of the liver. So both of them accelerate the progression of the liver disease. So where the person with only hepatitis B or hepatitis C takes few years to show the effect, with alcohol and fatty liver, the effect can be very faster, and the patients will develop all these symptoms in a few years.
So in fact, the acceleration may be as twice as the normal speed when the individual disease is present. If you combine both, it might be a much bigger problem. So one more thing is that usually common questions: if a person is from hepatitis B or hepatitis C positive and he's been adequately treated and the virus load is negative, the common thing is whether those patients can lead a normal life, or is there any problem with that, especially in terms of family life, marriage and children?
This is a good question which people would hesitate to ask. The first thing is, if we detect the disease early, if we detect the infection early, it can be treated and patients or people can lead a normal life. The basic idea of early treatment is to prevent the progression of the disease. So hepatitis B and hepatitis A have a very good treatment regimens with like just one pill a day can take care of the liver. So treatment of both hepatitis B or hepatitis C will definitely prevent the progression of the liver disease. That is number one. Number two is, because hepatitis B has a very good vaccination, we always suggest for the screening of the family of this patients who have hepatitis B. So all of them are negative. If every one of the family members are negative, then we tell them to get the family members vaccinated. Once the spouse is vaccinated, and there is no need to be worried about the sexual life or the kids. Unfortunately for hepatitis C, there is no vaccine. We would always tell for a barrier prevention wherever it is necessary.
And when you say, per se, if the family member is having a positive disease, is there any chance of using a food material with them or any other material which can transmit this infection?
So if there is a family member who is infected with hepatitis B or hepatitis C, as told before, the most common spread is through the blood. They can, kissing, using the same utensils, using the same towels, same toilet, nothing will accelerate the spread. Only thing is, if they use the same razors, toothpicks, so all those stuff they have to avoid.
So sharp should be avoided, which is getting infected, and just by having a normal day-to-day interactions, handshaking, kissing, or having a meal together won't usually will not spread the infection. And we have to empathize with the patient as well, because if you make him an outlaw in the family, it will be a difficult one. So the family support is most important.
They're not patients, the patients are the one who have neglected the presence of hepatitis B, then allow themselves to have disease. If they have disease, they are patients, but if they have infection, we should not call them the patients.
Yeah, true. So the message is clear that just by infection it doesn't spread with handshaking or touching. So it requires blood transmission. So if you avoid those things, I think it can be prevented. So just wanted to ask some more questions about the treatment, sir. So which patients require treatment, and who should be treated or who should be screened, so that if they can be treated with the disease disease?
So let's first talk about the screening. Screening is like everyone gets screened. That is very well and good. That is the theme of 2023 World Hepatitis Day also, that we can't wait more, because the aim is to eliminate hepatitis, especially hepatitis C, by 2030. So at a larger scale, everyone can be screened, but people who have to be screened, mandated, or you can say there is no scope of negligence, there is the people who are at risk, especially healthcare workers, transgender people, people who have or the community who uses the skin tattoos, people who have male-to-male sex, and people who are having addiction for the IV drug abuse, and people who have to undergo multiple blood transfusions. people who undergo dialysis, and these are some things I can, and the family members of the people who have hepatitis B.
Adding to that, pregnant females should be tested every time.
By default, they will be tested.
So one more thing is that, so this is the screening part. Now, once you screen, what are the treatment options they have, sir? Both hepatitis B and hepatitis.
The easiest way, when you screen it, there are some confirmatory steps, confirm the presence of the infection, and if you are negative, there is no infection, just get vaccinated. That's the end of the story. If you are found to be positive for hepatitis B, then not necessarily that everyone has to be treated. The treatment depends on how much the hepatitis has infected the liver. If the infection is not there, if the liver is not damaged, if there is only infection with the hepatitis B, there is no requirement for the treatment. You have to just follow up with your doctor. If there is already signs of liver damage, or the level of virus in the liver, in the blood is too high, then is the only time when we start the treatment, so that we can prevent the progression of that liver disease.
And hepatitis C, what is the treatment, sir? Is there a short course of treatment or a long course of treatment like hepatitis B?
Yes. Now, initially there was hepatitis C was very difficult to treat. Thankfully, the research has gone in, and now we have a very timed treatment. Once a pill for 3 months, 12 weeks rather. For pan-genotypes, depending on the liver disease, the stage of the liver disease. So, if you get tested for hepatitis C early, if the liver is not damaged, within 3 months or by 12 weeks, you will be off infection with hepatitis C.
So it has very good cure rate, with almost reaching up to 99% almost. Yes. So that is one thing. So second thing, sir, regarding the hepatitis B treatment per se, most common question is, if you are not being treated for hepatitis B for various reasons as you mentioned, what is the usual time to follow up, and what one person should do at a frequent visits?
Yes. Two things. One is the ultrasound, and the second thing is the blood test. Depending on what stage of the liver disease is there, your doctor will tell you, and also the screen for development of the cancer. So the cancer can develop it is a hepatitis B, a chronic liver disease, is a harbinger for hepatocellular carcinoma, that is liver cancer. So you have to be aware that whenever there is the advanced liver disease, there can be development of cancer without knowledge of the person. So we have to screen for development of the cancer. We have to screen whether the liver, the hepatitis B virus is under control or not. So what I usually do is, depending on the stage of the liver disease, I suggest people to get ultrasound and blood test every 6 months to 1 year.
So frequently getting tested, early recognition and prevention of complication is the most important thing in this disease aspect.
Yes.
So thank you, Dr. Ravi Kiran. This has been a very informative session. To summarize as such about the disease, so hepatitis is an infection or inflammation of liver. It is caused by various viruses which are specifically affecting the liver, like hepatitis A, B, C and E. And the most common notorious viruses which can cause chronic liver disease are hepatitis B and C. Both are well recognized and can easily be detected at an early stage, and has a very good effective treatment to prevent the complications. Even if you are positive, it is not a negative for your life. You always can get treatment and lead a good and healthy life. So as our theme of this year, we can't wait. We should get tested as early as possible, recognize the disease and treatment. This is an aspect of our discussion. So thank you for one and all. Thank you, sir.
Thank you, Vinay. So I want to emphasize that Dr. Vinay and I are available in Narayana Health City, Bangalore. Any doubts about hepatitis virus, any doubts regarding the liver disease, any doubts about liver transplantation, we are always available. We are always available for consultation in person or online. And also to emphasize that once you have advanced liver disease, there is no need for you guys to be worried about. We have a very good program of liver transplantation also, which can create wonders for people who have advanced liver disease. So any doubts, any queries about hepatitis or liver disease in general, you can always contact us at Narayana Health Bangalore. Thank you.